Hi, I'm Dr. John Lipman from the Atlanta Fibroid Center. I get questioned all the time about, I've had a pelvic ultrasound, why do I need an MRI for my evaluation to see if I'm a candidate for UFE? Well, ultrasound is a very good tool to diagnose whether or not you have fibroids, yes or no. The MRI is much greater resolution, much more valuable. It's really important that not only you determine if a patient has fibroids, but where they are in the uterus, because where they are specifically will determine what kind of symptoms you have. So, for instance, on the diagram here, you can see the different locations of fibroids. There's three main locations for fibroids in the uterus. There are those fibroids that are located right at the outer edge of the uterus, right underneath the outer covering. Those are called subserosal fibroids. Those are the ones responsible for the bulk-related symptoms, the pelvic pain and pressure, pushing on pelvic nerves that cause pain in the abdomen, the pelvis, the buttock. It may radiate down the hips and legs like sciatica from low back pain. Same exact type of pain. It can press on the bladder to cause increased urinary frequency and waking up at night to urinate from those subserosal fibroids that are pressing on the bladder. If they're located in the back of the uterus, subserosal fibroids can push on the colon to cause constipation, and those near the cervix can cause painful intercourse. So that's the first type of fibroid, the subserosal fibroid. There is the second type of fibroids that are located right underneath the lining of the uterus. Those are the ones responsible for the heavy bleeding. Those are called submucosal fibroids. So they're responsible for the heavy periods, the gushy, floody, clotty, crime scene, accident-prone periods. The third variety is in between those two, and those are the most common fibroids we find. Those are the intramural fibroids. Those are in the meat, the muscle of the uterus. And those are located in between the subserosal and submucosal fibroids. Now, they can cause either heavy bleeding, like the submucosal, or bulk-related symptoms, like the submucosal fibroids, depending on which way they grow. They grow outwardly, they'll cause bulk symptoms. They grow inwardly toward the cavity and lining, they'll cause bleeding, or they grow in both directions and they cause both. And so knowing exactly where one's fibroids are and correlating them with symptoms is really important. So in the middle diagram here, that is a picture from an actual ultrasound. You can see the bladder at the top, you can see the uterus, and they're outlining one fibroid with calipers. But you can see the resolution of this, while you can determine if you have a fibroid or not, is nowhere near the resolution of this image here, which is from an MRI. And you can see specifically that not only is the uterus very enlarged, this woman's uterus was enlarged like a 4 or 5 month pregnant woman. And the reason why it was enlarged is that all of these very sharply marginated black circles, those are fibroids. Interestingly, she has a second condition, which was not picked up on her ultrasound, which is very common, adenomyosis. If you look closely, you can see that the white cavity here is bordered by what should be a thin dark line on either side of the white cavity. That area is called the junctional zone. It's right beneath the lining, and it should be very thin, less than 12 millimeters in thickness. This woman's junctional zone was much thicker, and that's adenomyosis. And it's often not diagnosed on an ultrasound and very easily diagnosed here on MRI. So we want to get MRIs in every patient, and we want to correlate their symptoms with their imaging to see if it makes sense so that they will be candidates for uterine fibroid embolization.